So, with that said, I'm really delighted tonight to welcome, I wouldn't call her a guest speaker because she's one of us. Dr. Awolaran actually leads the Tripad Care Emotional Wellbeing Hub book club. So, and the book club meets every third Thursday of the month from 7 p.m. till 8 p.m. And the book that is being tackled, the big book that is being looked at currently is The Body Keeps the Score by Bessel van der Kolk. Very important book on trauma, one of the classics of the world in terms of trauma. So Dr. Awolaran is a consultant psychiatrist who works in general adult psychiatry in the community. But importantly, she's also a dually qualified psychiatrist. So she's both a fellow of the West African College of Physicians with specialty in psychiatry, but also a member of the Royal College of Psychiatrists. So she's qualified both in Africa, in Nigeria, and also in the UK, both as consultant psychiatrist. So she brings to tonight's event experience from both worlds. She has practiced effectively in both countries, both as consultants. So that's really, it's really a joy to have Dr. Awolaran, who is, as you will see very shortly, is an engaging public speaker. One of the things that really strikes me about the way she presents with ease is the way she brings life and realness and relatable scenarios and anecdotes to mental health themes. And this is not the first time she's going to talk about menopause, particularly on that. So the theme of menopause and mental health is our bread and butter, is something that she's very familiar with. And I've been looking forward to this evening for a long time, particularly because somebody asked me recently, somebody sent me a message this evening and said, "Oh, I'm surprised. I'm pleasantly surprised. I thought you were into men's mental health." And I said, "Yes, men's mental health is really my passion. However, the women on this group, the precious ladies on this group, have been asking for a long time that they wanted us to talk about menopause. And so I'm really delighted that there is somebody who is not only a tripad care insider, but somebody who is also able to talk about that from the woman's point of view. So with a lot of clapping emojis, please welcome to the platform Dr. Awolaran, Dr. Dorcas Awolaran. It's good to have you. Yeah, it's good to have you here. You are back home anyway. You are home, but it's really a joy to have you. Thank you for coming, and the platform is yours.
Thank you so much, Dr. Ajayi. Thank you for the opportunity. I remember how this came to be. I approached Dr. Ajayi while I was still in Kent. I wanted some guidance with, my psychiatric training and the rest. And it was so welcoming. And all this, the rest, they say, is history. It's been from glory to glory. It's been so down to earth. It's been so supportive. I know you all can attest to this because it's been here, at the Tripad Care for years, just churning out information that we need to know and how to keep our mental health and well-being stable. So thank you so much, Dr. Ajayi, for the opportunity. Thank you to every member of the Tripad Care team for what you do in the background and for keeping this good work going. Thank you so much. Thank you to the community, Tripad Care community, for showing up every time. You're always an encouragement to us when we get here and we see people already waiting. We're just happy to do what we need to do. So thank you all. Today, I'll be talking about menopause and mental health. Uh, Dr. Ajayi has kindly agreed to share my slides. I hope we'll be able to roll together. And maybe just before I start, we all know how important women are. We're so important that the Mother's Day or Women's Day, we have so many in a year, within a year. So today we're focusing on the women. And we also want the men that love them, their brothers, their husbands, their friends, to be aware as well. Because the more you know about people, the more you are able to handle them with care. And we women, we like to be handled with tender, loving care. So tonight is for us. Please oblige us and learn as much as you can about us. And beyond the learning, we all put it to practice. So once again, thank you for joining. And as we make a start this evening. So the topic before us is menopause and mental well-being. And I'll be talking, following an outline. We'll talk about a brief overview um, on the on this issue, on this topic of menopause. What do people know about it already? We talk about the recent Royal College of Psychiatry position statement on menopause and what that entails. Then we go into the real topic itself and some misconceptions about menopause, and then the core of the changes that happen in the women, the hormonal changes, and how that influences our mental health. We talk briefly about common psychological symptoms and risk protective factors, and also how do we manage them. So that's the outline for tonight. Let's get going. So, as an overview, it's been found that women account for 51% of the population, at least in the UK. And all women will experience menopause at some point. Dr. Ajayi mentioned this earlier. If they live up to the age of 45, 50, and above, at some point, they're going to experience menopause. Let's note that. Secondly, this menopause, even though it's a natural stage in life, it poses a significant impact on women's mental health and women's well-being in general. Thirdly, research has found in the UK that only 1 in 5 people, I mean adults, think that menopause can be related or associated with a new mental illness. Only 1 in 5. Whereas 50%, that is 1 in 2 of people that are going through menopause are experiencing some kind of neuropsychiatric symptoms. Can you see the gap between the awareness and what actually happens? Then, just 1 in 4 UK women feel comfortable to talk to their colleagues or to their bosses about, you know, issues with menopause, especially if it's a male boss. Why menopause as an issue costs the UK economy 14 million working days per year. So this overview clearly shows that there's a discrepancy between the awareness, people's awareness of menopause and the huge impact that menopause has on the economy and even on life in general. Next slide, please. So we now come to the Royal College position statement on menopause. The Royal College in March of this year, on the 1st of March, released this statement. And maybe to quote, it says, it's 2026. Yet, women in the perimenopausal or menopause stage are still in the dark without correct information. So, how are we supposed to make informed decisions if we don't even know what we're dealing with? That was the Royal College of Psychiatric position statement. And the main, conclusion of this statement is that we need to do better for the women. We need to raise awareness. We need to make sure that doctors are well trained to recognize and treat menopausal symptoms, even perimenopausal symptoms. We need to make sure that this goes back to when people are still in their training in school and even for the postgraduate doctors. We need to be sure that the community, women in general, are empowered, they are educated, they are informed to know about what they all deal with at some stage in their lives. So urgent action is needed. That's from the position statement, it highlights the fact that we need an urgent action to improve understanding and awareness of people in general. Because even though women are affected directly, we all know that anything that happens to mommy happens to everyone in the house. Am I correct? So by relationship, by extension, if women are being affected, then the whole society is being affected. So we know that the whole society must have improved understanding and awareness between the relationship between menopause and mental health. This is like the summary of the position statement. So now let's go on to what exactly is menopause. This menopause, What is it? What does it entail? And why is it a big deal? The truth is that most women at some point, I think I already mentioned this, we have to go through menopause. But why would they need to go through it in silence? Why would they need to go through it alone, feeling alone, as though what is this that has befallen me? So let's talk about the definition of menopause. So menopause is a natural biological transition that marks the end of menstruation. We all know that as a little girl, while a girl is growing up, there's a stage of puberty, and then there's that, you know, the almighty, let's put it that way, the almighty menarche. That is the stage where this girl sees the first period, the first menstruation. And that is like a welcome to womanhood. This is where, in fact, in some societies, in some cultures, there are certain traditions and ceremonies that are performed around this period just to initiate this girl into womanhood. And then fast forward between this period of, say, around, I mean, it gets earlier now. People get to see it around 9. Before it's usually around teenage years, but there's a range between, say, 8, 9 to 14. There can even be some precocious one that comes very early. Now, between that period where somebody gets the first menstruation, which is the menarche, and when this menstruation stops, which is menopause that we're talking about, that is the fertility window for every woman. Now, women are said to have attained menopause after they have gone through 12 consecutive months without having a period. And it's usually between the age of 45 and 55. But beyond that, because we all know that human beings can be very different, from individual to another individual. So this age range tends to change, tend to vary between people. But on a large scale, there are 3 stages. We have the perimenopause stage, we have the menopause stage, and then we have the postmenopause. The perimenopause will be just before, when there are some signs and symptoms just showing up, but this individual is still getting the period. It may be irregular, but at least the periods are still coming. And this is usually about 4 to 8 years before the periods stop completely. So we can usually put this perimenopause period between around the age of 40 and 50. So for some people, I mean, again, idiosyncrasies, individual idiosyncrasies, some people will get it earlier. I've met a lady that told me she was in her 30s when she got perimenopausal symptom, and I guess before she clocked 35, it stopped completely. So there are variations in people, but usually that age range. And then after the perimenopause, I mean, once it stops for 12 months, then that's menopause definitely. Then any period after the woman has stopped seeing the menstruation, that's the postmenopausal period. Now, I need to say this. It is still possible for women to get pregnant during the perimenopausal syndrome. So women, don't think you're completely safe when it becomes irregular. And we know, I mean, I've seen people, in fact, that they were on contraceptives and still got pregnant. First, they were shocked because of their age. They thought, why at my age? In fact, I've stopped seeing my period, or it's not as irregular. The fact that the period was irregular actually predisposes to pregnancy, and in fact predisposes to advanced pregnancy because before they find out. So I'm putting that out. It's very possible to become pregnant during the menopausal period, but when it stopped, like 12 consecutive months without a period, it's unlikely. I mean, naturally, it's unlikely. But we know we have different faiths listening tonight. But in Christianity, we know there's supernatural. We read the story of Sarah that was way past the menopausal, phase of her life, and we all read the story of how she became supernaturally pregnant. We also read the story of Mary, the mother of Jesus, that wasn't even, thinking of pregnancy, but became. So there are some outliers. There are some, supernatural incidences that can happen, but menopause marks, you know, the end of natural fertility for women. Next slide, please. Okay. So, what are some of the symptoms of menopause? Like I said earlier, every woman's journey through menopause is different. But we have various symptoms that people can, present with, like mood swings, joint pain in some people, weight gain. I mean, that is very common. People start adding weight. Usually, that is, termed to be related to aging around age 40. Even in the males, some of them tend to put on some weight when they get to the midlife, period. But hormonal changes can be responsible for this. For some women, they experience dry skin, and that can be the announcement of perimenopausal period. We have headaches, vaginal dryness, irregular periods. That's a very, very classic sign of perimenopause. The brain can become foggy. Some people experience breast pain and discomfort. Some people have night sweats, hot flushes, difficulty in concentrating, and poor sleep. All of these can happen in to different degrees in different women. So some women might not even experience, for instance, dry skin at all, but they may just have the irregular period. Some women may not even understand when you say there's joint pain. Some people might just feel, I just can't sleep at night, So every woman experiences. I mean, this brings to mind my mom, because I can remember vividly when my mom was going through menopause. She had to call us. Now, please take this from me. I never saw her ill before. I never saw my mom lay down or complain of any kind of ailment. But during this period of her life, the way she presented was, this is in retrospect, me thinking back, was excessive sweating. She was just pouring water. It was so much. And she kept feeling dizzy. She would feel like she's going to faint, and all sorts of weird symptoms. I think there was a time she couldn't sleep for about 6 months, and she would go to the hospital. They will have a regular check on her, routine check on her, and the doctor would say there's nothing wrong with her. And she went back and forth like that for months without knowing that this was menopause. I didn't know better then too. I was in the medical school, but I didn't know better. So again, this speaks to how it affects different people differently. And can you imagine, for some women, the announcement of menopause or perimenopause is just mood swings and depression, anxiety that they can explain, just a change in their normal way of life. Some people can become very angry, which I'm going to read out to us actually in one of the case scenarios today. So let's move on to what actually happens in the brain. Are we all still with me? Because I can't really see your faces. Let me check. Let me pause to be sure we're together. All right. Thank you. Okay. Thanks. So, to the hormonal changes that happen in menopause, we know that estrogen and progesterone are main hormones, main reproductive hormones in the woman, while testosterone is more so for the males. So what really happens is that there's a decline in estrogen and progesterone when women get to this particular age. There's a change in the FSH and LH, the follicle stimulating hormone, and all of that. So, but the key hormones that manage, the reproductive um, ability of a woman, the menstruation, and how that comes, and shedding of the uterine lining and all of that, estrogen and progesterone working in tandem together. Now, they keep things in balance in the brain, because these hormones, they have an effect on the brain neurons. Within the brain neurons, we have we call them neurotransmitters, but what they really mean, they are just like chemicals that just keep things going. If we want to imagine us cooking a pot of soup, so the neurotransmitters are like the Maggi and the salt, and they are just there in different um amounts to balance things out and make sure that the soup is really, really tasty. So that's how these neurotransmitters are in the brain. But fluctuations in these hormones, in estrogen and progesterone, then affects the balance in the neurotransmitters. A shift in balance in these neurotransmitters affects the way the brain functions. And I'm going to break that down shortly. So there's impact on neurotransmitters like serotonin, dopamine, norepinephrine, acetylcholine, glutamate, and GABA. All of these, please pardon me for these big names, but they are just like they make things go on well in the brain. So if there is an imbalance in this, it definitely affects how the brain is functioning, and that then shows up in the mood swings, shows up in the anxiety, shows up in the sleep disturbances and cognitive changes. That is the brain, the ability to concentrate, and the brain fog, so to speak. So to break it down, serotonin, one of the neurotransmitters, is what we call the feel good hormone. It just helps you to be at peace with yourself, and when you're feeling good, that's it. It's there in the right proportion. So what estrogen does in the body is to increase the level of this serotonin, and also increase the way the receptor is sensitive to serotonin, the receptor sensitivity of serotonin. Now, if estrogen reduces, which is what happens during the perimenopausal and menopausal stage, it leads to reduced serotonin, because I already mentioned that it increases its level. Reduced serotonin, which is a feel good hormone, what happens then? If a feel good hormone is reduced, then feel bad becomes the order of the day. So that is how it leads to depression. That is how it leads to anxiety and mood instability. And we all know that, serotonin, this group of medication, we call them SSRIs, serotonin reuptake inhibitors. They are used for both depression and anxiety. So we can understand how anxiety also comes into place here. So during this menopausal, postmenopausal period, there is a rapid drop in the level of estrogen, and then it leads to symptoms that sometimes feel in some women like they are withdrawing from taking an antidepressant like the SSRIs. And some of those kind of symptoms are like they feel like their brain zaps. Like some people would describe something is doing zzz in my brain. Like, what's happening here? Am I going crazy? Some people will talk about dizziness, nausea, low mood, anxiety. They're irritable. So that's serotonin. That's one of the neurotransmitters. The second neurotransmitter is dopamine. Dopamine is responsible for, in fact, is responsible for motivation. That is that ability to get up and go when you wake up in the morning, and you're just full of zeal and zest, and you just want to get up and do stuff. You want to go take that walk. You want to, engage in exercises and all of that. Dopamine helps you do that. Dopamine is also one of the hormones that we all chase when we are, glued to our phone, just typing away and engaging in some games and stuff like that, because it helps us feel good in some ways as well. Now, dopamine increases our focus, increases our motivation, increases our ability to plan and execute our plans. Now, if there is a decline in estrogen, there is going to be a decline in dopamine, and then a decline in every good thing that dopamine does for us on a normal day. So motivation drops, ability to focus drops, ability to perform executive function. So that women are just like very, very disorganized, so to speak, unable to follow through on their plans. Some people can even have symptoms that may seem like ADHD symptoms, like I keep forgetting stuff. It's because of the decline in this hormone. That's dopamine. The third and fourth neurotransmitter, norepinephrine and GABA. These two, I put them together because they do things. They are around calming. They have this calming effect on the body. They help for norepinephrine. It helps us to keep alert, and it also gives us energy. Why for progesterone, it just gives us this, we just feel calm and relaxed. Now, if there is a reduced level of estrogen, it will affect norepinephrine, just as it's affected the other neurotransmitters. And because norepinephrine is responsible for alertness, we can understand how women can then struggle a bit with keeping focus and alert. It can also make them feel tired, because if you're not focused, and they can feel stress more, because norepinephrine also helps to increase our energy, or is responsible for that feeling of energy. So without it, people feel tired easily and exhausted. So for progesterone, that has a calming effect. If there is a decline in progesterone, that means instead of feeling calm, we feel anxious. GABA, which is a natural anti-anxiety that occur, that is there in the body, and that is why we use some medications like gabapentin, to treat anxiety, pregabalin. So once there is a decrease in progesterone, there's also a decrease in GABA, and then the anxiety calming effect of GABA is lost, and it presents in the woman as increased anxiety, If you're anxious, you're unable to sleep, and then there's also increased stress sensitivity. Acetylcholine and glutamine. This is how neurotransmitter and the hormones affect memory, the brain fog, the inability to remember things. Decline in estrogen reduces acetylcholine functions. We know that acetylcholine is responsible for memory in the brain. The more the ACH, the better the memory. The less, the worse the memory. And then this leads to increased risk of dementia in women, which research has proven again and again. Glutamate works like norepinephrine. It's also responsible for alertness. So if there's decreased glutamate, that is this neurotransmitter called glutamate, there's decreased glutamate sensitivity, and then of course increased, anxiety instead of alertness, and then increased sleep disturbance. So largely, that's like how, breaking it down to the level of the neurotransmitters, that is how, the shift in the hormones cause all of these problems in the body. Now, if the shift in the hormone happened gradually, it would have been okay, right? But sometimes it doesn't. For some people, some women, they have this irregular shift in their hormone. It goes up, then it comes down, so it's, you can imagine the mood and all of the symptoms that we've talked about just swinging up and down, and that can be really frustrating. So some of the psychological symptoms that people experience include irritability, and you all know the reason why now, why they will become irritable. You all know the reason why they will feel anxious, why the mood will be low or depressed, or sometimes even, fluctuate between irritability and depression. We all know why there will be difficulty in concentrating and the rest. So these are the typical, psychological symptoms. So for women, honestly, it would have been better if these levels of the hormone remain persistently low. When it comes down, then stays there, it would have been easier. At least they will know that this is now my state. But if it goes up and down, people can actually suffer from a lot of the symptoms. I will say something quickly about depression and menopause. Depression um, and menopause. Depression is very, very common in menopause. In fact, that is one of the things that we need to look out for more in the clinics, especially when a middle-aged woman is presenting for the first time with depression. We need to ask around, hormonal symptoms, around menstrual history, and all of that. And the reason is because we already mentioned it earlier that dopamine and serotonin are responsible to keep the mood stable. But in this case, during this period, it fluctuates, and then the tendency to be depressed is higher. Now, but there's also something that predisposes people to depression, and that's why we need to take each woman as an individual. For some women, they have increased vulnerability to depression during the menopausal period, and this group of women, it can be due to genetics, maybe even before they got to this menopause stage. Could there be a family history of depression? Could it be that in the genes somewhere somebody had maybe bipolar or depressive disorder, or even undiagnosed or untreated depression? So if that is happening, then these individuals might be at a higher risk of developing depression during menopause than others. For some women, during childbirth, they may have had what we call, postnatal blues or postnatal depression, as it were. Um, for this set of women, the risk during menopausal period of becoming depressed is higher. For some women, they have this regular, we call it premenstrual dysphoric disorder. That is, when their period is approaching, they just they experience mood swings. I mean, most women do experience mood swings as their period is approaching, but some to a very larger, significant extent that it's very, very clear that something is not quite okay. And some actually require medication to manage this period. So for people like that with premenstrual dysphoric disorder, then during the menopausal period, you can imagine that they will be at a higher risk. Also, some people are more sensitive to hormones or just sensitive in general than others. And people like that, you have to look out for them. So how can we get this? It's just because it's when we take the history during when you go to the clinic, it's about asking and asking around, and then also getting this knowledge that you are equipped with tonight helps you to think and just look around and check, okay, is there anybody with this? What happened when I gave birth to my children? Was there any risk posed at any point at all in my life? And some people's brain are just more sensitive and to the changes in the hormone. So why some would not have any symptoms or will have minimal symptoms, others would experience significant symptoms during the period. So for anxiety, I think I'll skip this because I've already talked about it. We all know that anxiety would affect sleep. If you're anxious, you panic. If you're anxious, you are likely not, able to sleep. If you're unable to sleep, it's likely to cause you to be more anxious, and it just goes on and on. If you're unable to sleep, is likely to cause increased stress from chronic insomnia, and then you are likely to be more irritable. So let's just remember to summarize this like that: the body and the mind are just interrelated. Anything that happens to the body affects the mind and vice versa. So if a woman is not sleeping because of these changes in the hormone, you can imagine what will happen during the day. So it's just about that really. And then if you are not sleeping, we all know you are likely to be more irritable. I knew this when I was taking on calls, when I was a junior resident, and I would just it's not natural. You have to take on calls. But at first, I didn't realize until much later, maybe maybe when I became a senior registrar and I stopped taking on calls, then I realized that I'm actually feeling a lot better, like normal over a longer period of time without, any lashing out or whatever. So came to the conclusion that okay, sleep must be one of the things that sometimes affect our mood, whether we are perimenopausal or not. So we need to know that sleep is very important. So cognitive changes, we talked about the acetylcholine and how it manifests as memory lapses, reduced concentration, reduced processing speed. People just I hear people, ladies, talk about this. They say, I can't read. I'm not as brilliant as I used to be. I was very, very brilliant. It's menopause, it's perimenopause. It's not, there's nothing wrong with your brain. It's just because of these changes that is happening. So people experience it to different degrees. Some people will just realize that they forget things more easily, and or they struggle with certain things that they used to, do easily before. So that's that. And then maybe again, sleep. I know I've talked a lot about sleep, but it's just to let us know that sleep is very important for mental well-being. For us to be able to, even if you're perimenopausal, even if you're menopausal, if you're able to at least manage your sleep, it goes a long way. Because insomnia, even though it happens due to hormonal shift, insomnia, which is poor sleep, happens due to hormonal shift. Poor sleep we also worsen your mood. I think I already said that as well. So how do we help to maintain our sleep? Good sleep hygiene. I just found this picture. I said I'm going to share it with us. It's talking about the do's and don'ts of good sleep hygiene. So what you should do and what you shouldn't do. I will start with what you shouldn't do. I know we know it, but I'll say it again so that we'll remind ourselves. Don't eat large meals before bed. You can imagine that your system will be busy trying to digest the meal instead of resting. Get in bed. Don't get in bed to watch TV or do any work. Don't do that. Don't nap too long in the afternoon because you might stay wide awake at night. Don't drink too much caffeine or alcohol. Don't do that. For me, it's Coca-Cola. Once I drink Coke, I know I'm not sleeping until 12 noon. 12 midnight. So you know yourself. What is it that keeps you awake? Avoid it. Don't bring screens to your bedroom and all of that. And then we know the things we should do. Stick to a schedule, a normal time to go to bed, say 9 or 10 p.m. Exercise during the day. Make your bedroom very relaxing, dark and quiet, and then you can have a soothing shower just before bed. So that is just to overemphasize sleep and sleep hygiene. I want us to take a break just for some minutes to talk and allow the audience actually speak about the common misconceptions about menopause. What are the misconceptions that people have heard about menopause? and women in general. Anyone, please feel free to talk.
Hi, can I say
Yes,
something?
please. Thank you.
Thank you so much for this enlightening conversation. I think that, especially things like menopause, people think that you have to be old to go through menopause, but I've heard research that it actually starts younger in Black women, and I don't know if that's correct. Yeah, but that's there. There's been research to show that it actually starts younger in us as Black women. Interesting.
Yeah. Thank you so much for sharing that. So a misconception is thinking that you get to about age 50 or 60 before you get it. You might be in for a shock. Somebody put here that dementia, that it causes dementia. Uh, can I see? Okay, I will allow Princess Folaji, please carry on.
I believe, well, I think you mentioned it already, but people think it's a form of contraception,
Hmm.
and that you can't get pregnant
Oh,
once you reach menopause.
hmm. Oh, and they're
The
in.
other,
Yeah, yeah. Sorry.
sorry,
Carry on, please.
the other misconception, and I don't know if you're going to touch on that, is that both some men go through something similar, and so they think it's the same. I don't know.
Something similar like what, ma?
Like middle age crisis or something like that.
Midlife
So,
crisis. Okay.
sorry, midlife crisis. So
Okay.
they think it's the same kind of symptoms and feelings, and
Hmm.
it's not.
Thank you, ma. Thank you for sharing that. Yeah. So some men think it's the same thing. Oh, somebody's saying andropause. Okay. Can black women take? I can't see that. So somebody put here, people are still scared to use HRT. Yeah, that's part of what we're going to be talking about tonight. Um, can black women take HRT? Yeah, absolutely. Black women can. I know if it's a misconception, I don't know if it's a misconception, but people say you must use HRT on time before it's too late. Yeah, yeah, that's kind of true. The earlier the better if you're going to use it. I've heard men claiming to have something similar. Somebody's talked about that. I've heard someone said she thought she was possessed by evil spirit. Wow. Can you see that? Can you see that? Hmm. Okay. Some may feel they can't have intimacy with their husband. Thank God the men are here also tonight. Yes. Okay. Sorry. I need to clarify that. Somebody said, do you mean one can still get pregnant after menopause or at menopause? What I actually said was that during the perimenopausal period, where there are irregularities in the menstruation, that it's not, I mean, yeah, pregnancy can still occur during the perimenopause, and this is between age 40 to 45, sometimes even 50, 55, if it hasn't stopped completely. So menopause is when it stopped for 12 consecutive months. It's after menopause. That means you've not seen the period and you've waited for one full year without period. That's when we can say you are now, menopausal, and that is when we can say, okay, pregnancy might be a lot more difficult during that period. But we then said, according to our faith as Christians, that we've read in the Bible, people that got pregnant outside, way outside that period, and so what God cannot do does not exist. Like, Pastor, somebody says it. Yeah, I'm not sure I'll be able to take everything, but yeah, there are misconceptions. And now, oh, Grace Oshin, please carry on.
I was just also going to add, thank you for this information so far, so good. To add that it's possible to manage, and then one of these misconception people have is that it's like you're doomed once you get into that zone, but it's really
Absolutely.
manageable, and that's the positive information from this as well.
Yeah, yeah. Thank you so much for sharing that. Thank you so much. So I have a few misconceptions here that I found while I was preparing for this meeting. Some people believe that menopause means a woman is no longer useful, which is like what Grace just said, that they're doomed. That's not true. In fact, a powerful new chapter of your life has just started as a woman during menopause and perimenopause. So some people think that the symptoms like the fatigue and maybe the excessive sweating, blah blah blah, they think that it could be malaria. No, it is not malaria. It is natural hormone fluctuations that is causing those symptoms. Some people think that postmenopausal women are physically contaminated. Has anyone heard of this before? That they are contaminated, they should be avoided. Can you imagine? I can see Princess Folaji still raising her hand. Is that an hold hand or you want to say something? All right. So so
Sorry,
they think,
sorry,
yeah,
that's my old hand. I'll
okay,
take
so
it down.
that's fine. Thank you. So
I wanted
some
to
people
ask.
think, sorry, solution?
Yeah, I wanted to ask. I'm the one who raised the hand.
Oh, okay.
No, I
Please
did.
carry on.
Can I go
Yes,
ahead?
yes, please.
Thank you. I just wanted to find out, like menopause, does it impact the digestion system? Like maybe when you eat, like does it take long for the food to be digested? I don't
Okay.
know.
Yeah,
Yeah.
that's questionable. Well, maybe we can wait till the question time. Do you mind? Or do you want me to answer it now so that we don't forget? Well, I know it affects the metabolism, and then we can bring that in in that regard. So anything that affects your basal metabolic rate affects the way the body functions in general. So the same hormonal changes in the body can affect metabolism, and then that can show up as, reduced rate of digestion. Okay?
Thank you.
Can I ask my question now, ma'am?
No, sir, please. I'm so sorry. We need to wait for the question time because I need to finish this presentation.
Okay.
Hope you don't mind. Yeah, there will be 30 minutes for questions at the end of the presentation.
Okay, if I'm still there, fine.
Thank you. Thank you very much. All right. So let's move ahead. So misconceptions. So the thing that women was saying was that the last one is that menopause is something that shouldn't be discussed publicly. That's a big lie. Even the Royal College of Psychiatry is saying, raise the alarm, shout it out, and let people know about it. So I want to read out two case scenarios, about women that had experienced menopause and how they experienced it. And we'll see what one or two things that we can learn from them. So the first one said, my menopause journey began about 3 years ago when I was around 44 and started getting perimenopausal symptoms. I had no idea what they were. I was working as a receptionist in a busy accounting firm when I started getting symptoms like anxiety, mood swings, and poor concentration. I felt very different. I became panicky when carrying out my duties as though I have not prepared enough. I remember thinking, what on earth was going on with me? I thought I might have early onset dementia because of the brain fog. I felt exhausted by midday and I thought I was pregnant at some point, except that I was still having regular periods. I had bouts of anger and very low mood just before my period. I remember blowing up once in front of some visitors and then having to apologize. I was having a few hot sweats at night and hot sensations, but I just did not link it. Eventually, I researched my symptoms, which helped me join the dots and realize I was going through the perimenopause. I attended my GP several times, got antidepressants with no improvement of symptoms. Eventually tried HRT, that's the hormone replacement therapy patches, but did not get on well with this lady. Then I tried the Mirena coil with progesterone and estrogen gel, which made a huge difference to my symptoms. Can we see that journey? So for this woman, she tried a few things before she got the one that was right for her. And at the beginning, she was just like, "What's going on here?" It was a shock to the system. So that's her story. And I can imagine if a few of us here can relate to this woman's story. The second story, even is a sad one, but I want us all to listen. This is Miss Hay. She's a 56-year-old woman. She had first contact with the community mental health team following a hospital stay for an attempted suicide. She was discharged to the care of the community team in September of 2019 with a diagnosis of psychotic depression. In May of 2020, she attempted suicide again for the second time and was discharged to the care of the community mental health team after being in hospital. But in August of 2020, she died by suicide, so she succeeded. In this case, menopause was a potentially unconsidered physical health factor. The patient's sister told the team that the impact of menopause on her was profound, both physically and mentally. So from the report, and all the incident report and the rest, they made some recommendations that the Royal College of Psychiatrists work with relevant people and organizations to identify the best way to consider menopause during mental health assessment, to raise awareness about menopause symptoms, which is what we're doing now, so that it's not mistaken for depression. Somebody can come depressed, but it may be beyond that. To make sure that there is increased research into the impact of menopause on mental health. And then HRT should be considered as a treatment option when women talk about low mood during midlife. So it's not just about the SSRIs now or the normal antidepressants. HRT, hormone replacement therapy, should be an option at some point. Additionally, menopause needs to be considered during mental health assessment for every woman in the midlife. Like I said earlier, not every woman will come down with these symptoms. But once you see a woman presenting, it's better to cross the T's and dot the I by making sure you ask. Oh, sorry, I'm talking as if I'm speaking to psychiatrists again now. But people generally, we should just all be aware and know that there's something called menopause, and we should ask around it. So if you see, for instance, a neighbor or a friend talking about just feeling somehow, ask them, and guide them to go to their GP to seek help, because as we would see later, early intervention is very, very important. So, like we said, not everybody will get it, but what are the risk factors in people that are likely going to get it? One, biological predisposition. I think I mentioned this earlier, but we can't overemphasize it that some people's brain are more sensitive to these hormonal changes than others. And like people that have had previous, postpartum depression, people that have premenstrual dysphoric disorder, people that have a form of mental illness or the other, they can be more predisposed to developing perimenopausal psychiatric conditions or mental health challenges in the perimenopausal or menopausal period. Two, there are psychological factors that could, increase the risk. Again, like somebody that is naturally an anxious individual, you know. So some people just have that anxiety, and they have the personality trait of people that can be easily thrown off or easily anxious. Um, People that have had history of depression or anxiety, or even a family history, like we said earlier. Okay, maybe that will be biological. And then some people have negative attitudes towards aging. One of the things that I didn't talk about during the misconceptions is some cultures actually have this negative attitude towards women once they are menopausal. Like, for instance, the one that said that women are contaminated and they should just be left. Some men actually go out to marry more wives during this period, that this one is no longer functioning. It's because of what has happened. So let's open the gates. So we now know better. It can be treated, it can be managed. So um so I've talked about the psychological, then the social risk factors. We know that it is still during this midlife that women, well, men as well, they go through life transitions, like the empty nest, period. So people are actually struggling with emptiness, which could also contribute to the low mood and the feelings of anxiety that they're having. People during this midlife, if they have aged parents that God has graced with long life, they are likely to have aging parents that they are also taking care of. Aging parents are likely to be ill. So there are so many things that may be on their plate at that time. Life transitions, a social risk factor for developing, perimenopausal mental health issues. Then career changes is happening around this period. Retirement planning. People even at work are finding there's something called ageism in general, even though there's strong talks against ageism now, but you can imagine how much women in the past have gone through around this age group. Then relationship shifts can happen. It's sorry, but some people go experience divorce during this period. And I already mentioned that some men, apologies to the men that are here. We know that men that are here are like pastors and or very serious minded people. And I'm not saying anybody otherwise not serious, but what I mean is that men sometimes, because of cultural influences, actually get new wives during this period. And you can imagine the pressure on the older woman as a result of menopause. Cultural attitudes towards aging, I already mentioned that, and femininity. So all of these risk factors can predispose apart from the hormonal changes happening in the body, can predispose to these mental health challenges that women go through. So when do we seek professional help? When should we ask for help? So when there is persistent sadness and hopelessness, like that second case that I read, she kept trying to end her life. And before a person gets to that stage, there must be a very, high degree of hopelessness and helplessness. So when somebody is persistently sad and feeling helpless and hopeless, it's time to seek help. That means the person cannot shake that low mood away all by themselves. When the anxiety is severe or even leads to panic attacks, because one of the symptoms I forgot to mention is that perimenopause and menopause also predisposes to increased cardiovascular, you know, um, symptoms like high blood pressure and that, women that never had elevated blood pressure, they find that during this period, they suddenly, out of the blues, the blood pressure is high. It's because of the hormonal changes, affect the thickening of the vessels in the body, and then leads to, tonicity, hypertonicity, and then high blood pressure. So if women know this ahead of time, they don't have to get to that stage and start using antihypertensive because it can actually be prevented. I only imagine when I was, preparing for this, I imagined how many mothers have now started taking antihypertensives when they could have been prevented with hormone replacement therapy at an early stage. And then this brings us to the reason why early, identification, early treatment is very key. Okay. So thoughts of self-harm, again, like that woman we read about in the second scenario, if it's affecting your functioning, if you realize that you're unable to function as you should do normally, then it's time to seek for help, because the inability to cope with the same, women naturally are resilient. So if you are now struggling and you see that you are unable to cope, it's time to seek for help. For some women, like I said before, it wouldn't really matter much. They feel some discomfort, but they're able to carry on. But for those that it's interfering with their daily life, affecting their quality of life, it's time to seek for help. Okay. And then where do you seek help? You can approach the GP. Like the first case scenario, she actually went back and forth, tried several medications before they got the right one for her. So approach the GP. If they say nothing, tell them about the RC psych position statement. Let them know that everybody now knows about menopause. So I mean, some of my clients are coming and they tell me about, I think it might be I have PMDD, and I just smile because I like, at least now they know. They can actually say that to their doctors to say, treat me well, doctor. So, what are the treatment options? Following the biopsychosocial, approach, biological treatment, we want to think about medication, which can be hormonal or non-hormonal. So, but the very, very classical one for menopause is the hormone replacement therapy. That's like the gold standard, also, so to speak, for people that it's not contraindicated in them. Because for some people, they may not be able to use the hormone replacement. And like that case scenario one that I read, she tried the hormone replacement, the patches, it didn't work with her, but she had to shift to another hormone type. So medications like SSRI, like the antidepressant, and some anti-anxiety medications can actually help, because based on the breakdown of the neurotransmitters that we talked about earlier, it's this medication will help to balance the imbalance in those neurotransmitters, and that's how it helps to manage the symptoms. Then for the hormone replacement therapy, again, the hormone that is now reduced, you are introducing it from the external so that you can raise the level and then balance out things. I think I should say this here, that menopause itself is not a disease, it's a natural stage of life that everybody will go through. What we're trying to manage here is just the discomfort that the symptoms bring about during this period, and to allow people function well in their day-to-day, job and activities. Really. So medications and the hormone replacements are like classical. And then for the psychological, method of treatment, it's the cognitive behavioral therapy, CBT. Cognitive behavioral therapy will help to identify I found out that there is actually a menopause specific CBT. And it will help this woman understand these symptoms are psychological, understand the basis for which the symptoms are happening, and then help to reduce the impact of the flushes. So by understanding what is happening in their body, then they can shift their perspective of what is happening and help them manage and cope better. So they identify, these mood swings when they come up. They are able to then learn skills to regulate these mood swings. And then if there's any, you know, awkward or unusual thoughts coming in, they can fight that easily. What you don't know can actually make you so scared and afraid. But once you know about it, once the awareness is created and more people know about it, I guess it's going to help be very helpful. Another CBT that will help with menopausal women is the CBT for insomnia, because insomnia, poor sleep, also a key symptom. So it helps them to understand why this is happening and help to reset their sleep patterns. Teach them relaxation techniques um, to help them get to sleep and to actually get good sleep. CBT will also help to build their body and self-image, because again, the cultural things we talked about. People, some women start feeling so bad during this period. They feel like, and people also are not too nice to women. You see, I hear people talking on social media about, oh, this woman, she's now old, she should go and rest. She should. It's not fair. So all of this bullying, because there's no other name for it, body image shaming and all of that. CBT can help build resilience against that, so that even if people come with such, statements, they can navigate it and help themselves to cope better. Peer group and support groups for women. Women can be empowered to, pull together support from their groups. They can help each other understand what they're going through, and then this will make them feel less alone, because sometimes it can be a lonely place to be when you feel it's only me that all of this is happening to. Knowing that this has happened to someone else, knowing that someone else is experiencing something different, but it's actually due to the same cause, can be freeing sometimes. Then lifestyle modification, like healthy diet, exercising, taking supplements that can help to, keep the bones strong. We know that this perimenopause and hormonal changes can predispose to weak bones and all of that. So lifestyle medications to prevent all of these effects of menopause can also really be of help. For women that are experiencing low libido during this menopausal period, some people try testosterone, and it helps to improve them, and some other, medications that helps to improve libido. I need to mention this for people because somebody already mentioned it, that in Black women, it actually happens earlier. But beyond that, there are certain people that they have premature ovarian insufficiency. These people, they get the menopause early. I told you I met a lady that she was in her 30s when she first started getting the perimenopause, and then menopause came at about 35. So these people, what do they do? Evidence strongly supports hormone replacement therapy in them because they are quite young. And so that helps, and that speaks to the earlier the introduction of the HRT, the better. So hormone replacement therapy will help calm the symptoms, help keep them stable for longer. Okay. And so we're almost wrapping up now, and we need to talk about protective factors. And this is because we are focused on mental well-being. We don't want to wait until something goes wrong before we take action. So what can we do now to protect ourselves from actually experiencing these symptoms? Or even if we're already experiencing it, but it's not so bad, what can we do to cope better? Strong social support, which is part of what Tripart Care provides. Learning about all of this is very good. I've mentioned this before. Regular physical exercises. Make sure you engage in, even if you can't go to the gym, get some exercise in the house, in the garden. Get a treadmill if you're able to afford that, or just take a walk. Make sure that you have regular physical activity. Balanced nutrition, including supplements like calcium, like vitamin D, things that will help to boost your overall well. I mean, some people talk they sell supplements for women, specifically for women of this particular age group. Try out these supplements and balanced diet. Stress management practices. Whatever it is that menopause would cause in an individual, stress will magnify it. Stress is not good for anybody, be it male or female, be it menopause or andropause. Even for children, stress is not good for no one. So, how can we manage stress better? Even if our occupation is stressful, we need to seek out ways to manage stress. One of the ways we can do it is the mindfulness and all of that. The other day I was in the I was at the clinic. I hope your guy is not here. I was at the clinic and the patient, maybe they canceled or something. I was alone in the office. And I just thought, okay, this mindfulness thing, let's try it. Brought out my laptop, opened to a lady telling me, okay, sit, put your legs down, do this, stretch this. I did it in the office. You won't believe it. I felt really good and really energized after. That didn't last more than 10 minutes, but it made my day. So find way. You have to be intentional about managing stress. So let's make sure that we manage stress. Don't take on too much. Delegate when you need to delegate. Yeah, say no to people when you need to say no, so that you don't have too much on your plate. um Mindfulness, meditation. If you're a Christian, praying. Research has shown the power of prayer in stress management. Reading the Bible, just reading books, it also takes your mind off whatever chaos is happening and just stills you. That's why I'm leading the book club. I love reading books. So join us in our book club and just learn about how you can manage stress more. Manage stress. Positive coping strategies. We can't overemphasize that. I've already mentioned a lot of that. So part of it can be just talking with a girlfriend, a trusted girlfriend. Just share the burden and let them know that you're going through this. They may be the one that will direct you in the right, direction to find help, the help that you need. So just to wrap things up, well-being approach, which is what we stand for here. Make sure that you go for your yearly or 6 monthly physical health monitoring. If your GP is not giving it to you here, if you need to go home to get it done somehow. Check your, mammogram for women, check all the blood, E and U, all of that. Check everything. Make sure that especially once you are around age 40, 45, make sure that physical health monitoring is priority. Mental health screening. Look at yourself in the mirror. Check. Are you fine? If anything is off, the truth is that you know it within yourself when all is not well. You know it within yourself when you are beginning to feel on the edge, when you're feeling pressured. Just take a break and take some deep breaths. Also, talk to your GP. Make sure you know when the mood is staying low for too long, and get out of the house, get into the sun, get some just screen yourself. Low mood, anxiety, all of those things, get checked before it's too late. Emotional validation, make sure you do that for yourself and with your friends. Look into the mirror and talk sweet things to yourself. Let yourself know that you love yourself, and let yourself know that nobody can love you more than you love yourself. So the better you love yourself, the better for you. Validate yourself emotionally. Do good things for people. Sometimes it helps. That helps you to feel good. Sometimes when you do good for other people, it's actually selfish, even though it looks like it's outward. It's because it makes you feel good. You feel good that you've made someone else feel good. So do a lot of that. Emotional, okay, I've talked about emotional relation, community and family engagement. If you belong to a community, make sure you engage, make sure you are in good terms with people in general. But before you can even be in good terms with people, be in good terms with yourself. I think I would say this: one thing that most people need, is love plus forgiveness. If we're able to do those two things, life will be better for everyone. Just remember, love and forgiveness. Add those two for any equation to any relationship: love and forgiveness. If the person has offended you, offer forgiveness. If the person has not offended you, offer love. If the person has offended you and you want to feel good, offer love and forgiveness. Like, if you mix it to any concussion when it comes to relationship, it will turn out well. Love and forgiveness, and it will do everyone good. And then empowerment and education, which is part of what we're doing here tonight. We are now empowered. We now know about menopause, and we can spread the news in our various communities so that other people can know as well what's the basis of this thing, what's really happening, and how to tackle it. I'm wrapping up now. So the take home messages for tonight, just to summarize: menopause is a natural life stage. It's not a disease. It's what will happen to every living human being, or not human being, every living woman. If they keep living, they will get to that stage. Two, mental health challenges are common. 50%, we read, research has shown 50% of people in this stage face some kind of mental health. If it's not depression, it's anxiety. If it's not anxiety, it's insomnia. So it's very common. If it's not insomnia or depression, it's brain fog. All of these things are very common. Early recognition improves outcomes. So the earlier we recognize it, the earlier we're able to do something about it, and then it improves outcome. And then education, support, and empowerment for women are essential, not just for women that we know in our capacity. What just comes to mind now is imagine women in the rural areas. How are they going to get to hear about these things? What are we going to do to make sure that they are not left out of this, empowerment? And even the men too, they need to know, because if they know better, they will do better. So I think that's the end of my presentation today, and then we'll go to the questions. I hope you guys will be gentle on me. Thank you all for listening.